to be addressed for the American people. What's the plan, the overall plan, should this virus infect Americans in high numbers? What's the plan for increasing diagnostic capacity? And what's the target number for that? Dysfunctional tests, we all know, have limited our ability to diagnose the virus. And the small number, it could be said, of U.S. cases may reflect limited testing and not the virus's spread. But it's up to our professionals to put out with clarity that kind of information. What's the plan for protecting our healthcare workers that are in the front lines of this? What's the plan to increase hospital capacity? Now, in my view, the United States of America has the premier professional public health professionals in the world. In the world. Our scientists, our doctors, those that are heading up the agencies, those that are part of the agencies. I think the problem rests more with administration people. One saying one thing, others saying something else. I think that the briefings that are done for the Congress, if I might suggest, should be open to the public. There's no reason to have secrets about this. And I say that because it raises the element of fear with people. There's something going on behind closed doors that they're not telling us. And it's a time for us, if I might use the expression, to give them an inoculation of confidence. And certainly the virus triggers fear, and I think the antidote for this is truth and transparency, including informing the American people of a coordinated, fully funded government plan to keep us safe. These are not things they can do for themselves. We are the ones, you are certainly in the driver's seat on this, I think that the funding request, and later in my questions I'll ask you about that, is wholly inadequate. Now, before requesting the emergency funding, the President's budget contained dangerous cuts that weaken our public health frontline response, gut the health care safety net, and end programs focusing on increasing our health care workforce. So we're driving in the wrong direction. It's as if there's a fire and the fire engine is going down the wrong end of the road instead of to the fire. We need these resources in order to care for the American people. As the author of the Pandemic and All Hazards Preparedness Act, I know that the best way to fight outbreaks is by preparing and investing in advance, not by rushing after a pandemic hits. And while the virus is spreading, the President's budget cuts almost $700 million from the CDC, $430 million from the National Institute focused on infectious diseases, $3 billion from the government's global health program. This is a jaw-dropping $1.6 trillion cut from the very federal programs that cover 1 in 3 Americans. This doesn't make any sense. And the President's budget virtually ends the workforce development programs that train more than 500,000 clinicians each year. I see them every week in my congressional district at Stanford Medical Center and Lucile Packard Children's Hospital. So the budget weakens our public health safety net, and it hurts our country's resiliency. The CDC, NIH, all of these agencies cannot run on fumes. Cannot run on fumes. And it's not even a Tesla if it doesn't have a battery that's going to last. And if Americans are uninsured or underinsured, they're not going to seek care, and that will contribute to the spread of the disease. So I don't know what is the President often has promised beautiful health care. I don't find beauty in what I just said, and I'm sorry that this is a part of it. So with that, I'll have questions, and Thank you again for being here. The chair now recognizes Dr. Burgess, the ranking member of our subcommittee, for his 5 minutes for an opening statement.
I thank the chair. Thank the secretary for being here. Always great to see you in our committee. I hope the feeling is mutual. You always are grateful to be here in our committee. I just have to say, Madam Chair, that 2 weeks ago I was criticized rather severely for even suggesting that we needed a coronavirus hearing. The work we were doing that day, which was a bill that was never going to become law, was so important that we didn't need to do that hearing. We did need to do that hearing. I'm grateful we're having it today. I'm grateful we have the secretary. Now, this hearing is also being coincidentally run with the President's budget proposal for fiscal year 21. And that's a lot of stuff to cover in one hearing, but I guess we'll do our best, Mr. Secretary. So let me just say, I do appreciate the administration's commitment to health care. I appreciate the commitment to lowering health care costs and reducing the complexity of the system so that patients can more easily access their care. One thing the administration and Mr. Secretary, particularly you, led on was advancing kidney health for Americans. That trend continues in the Health and Human Services budget proposal and the support for H.R. 5534, the comprehensive immunosuppressive drug coverage for kidney transplants patients. As you know, Mr. Secretary, this bill would extend Medicare coverage of immunosuppressive drugs past the current 36-month limit. A patient with a kidney transplant needs to take immunosuppressives or their body will ultimately reject the graft, causing the patient to return for dialysis treatment. A kidney transplant is indeed an investment in the future of that recipient patient, and this bill will help protect that investment. I've worked on this policy for a decade, and I'm thankful it has been highlighted as a priority by the administration. It's time for Congress to finally pass this common sense legislation. The budget also continues the work of the SUPPORT Act, one of the major pieces of legislation passed in the last Congress, by making clear that the opiate epidemic and programs in the oversight investigate and making sure that the opiate epidemic and response programs are indeed a priority. In our Oversight and Investigation Subcommittee, we've heard from various states about the efforts they are making to help those with substance use disorder. Funding for these state opiate response grants is imperative to allow states to find the innovative ways to combat this crisis. I also appreciate the fact that the administration included Hyde Amendment pro-life protections in all proposed funding language. It is important to ensure that federal funds are not used to perform abortions, and I hope as this subcommittee moves forward with reauthorizations and the Appropriations Committee puts together the bills for fiscal year 2021, they will maintain those protections. Other important programs and policies receiving increased funding, including the Maternal Child Health Block Grant, the Health Resources and Services Administration's Maternal Health in America initiative, and the 340B drug pricing program. Funding increases for the Centers for Disease Control and Prevention's influenza program is particularly important as we now face this worldwide coronavirus outbreak. Which brings me to the novel coronavirus, and it has infected over 80,000 individuals worldwide, proven to be more deadly than SARS. I appreciate the Trump administration's vigilance and rapid response efforts. Mr. Secretary, let me just say, I was so heartened, I think it was 4 Fridays ago when you came on the air and said there was a limit to people being able to come into this country from China, and I thought that was important that the administration say that. And I believe that is one of the central things, my thesis is, that is one of the central things that has provided us at least a little breathing room as this virus erupts around the world. We're fortunately not as affected as some other countries. Now it's incumbent upon us to make sure we utilize that time wisely. Certainly the Pandemic All Hazard Preparedness Act, which was worked on by this subcommittee in the last Congress and finally passed at the beginning of this Congress, important piece of legislation. I would have liked for us to have done real-time hearings, updating. Are we doing what was intended with that bill? Is the stockpile responding appropriately to the authorizations that we made? And this is the type of information, rather than the political rhetoric back and forth that we've heard, this is the type of information that I think would be helpful and indeed reassuring to the American people. You can't ignore the fact of what's happened to the markets. Today, we're grateful that they've seemed to have rebounded a little bit. But look, we all know China has not been forthcoming with information, and it is that uncertainty that I believe is driving one of the negative forces driving the market. Mr. Secretary, I appreciate you being here today. We'll have multiple questions for you. I certainly look forward to your testimony. Thank you. I yield back.
The gentleman yields back. I want the ranking member to know the following. On January 30th, I requested that the following week that we have a hearing on the coronavirus with the heads of the agencies. The secretary leaned in and said, I head up the effort and I want to be there with that team. And here we are today. So this is not something, Dr. Burgess, that we just casually overlooked or ignored. That is far from the fact. I now would like to recognize the chairman of the full committee, Mr. Pallone, for his 5 minutes.
Thank you, Chairwoman Eshoo. Today's hearing serves two critical purposes. First, we will examine the Trump administration's proposed budget for the Department of Health and Human Services for fiscal year 2021. And second, we'll get a crucial update on the administration's ongoing response to the coronavirus. I am disappointed, though not surprised, that the Trump administration budget proposal completely contradicts the health care promises that the president repeatedly makes to the American people. When it comes to ensuring the American people have access to affordable and quality health care, the Trump administration has failed them, and this budget proposal continues that record. 2 years after showering the wealthy and large corporations with major tax breaks, the president's 2021 budget proposal slashes $100 billion from the Affordable Care Act, $500 billion from Medicare, and more than $900 billion from Medicaid over the course of 10 years. And the president also wants to make it easier for states to take away people's coverage, undermine their care, and cut critical benefits. And this puts the health and well-being of tens of millions of children, parents, pregnant women, and people with disabilities at risk. Medicaid is a lifeline for millions of working-class families, and it's unconscionable that the president wants to cut it to pay for tax cuts for millionaires. Now, these budget cuts also fly in the face of President Trump's own words. He promised that as president, he would not cut Medicare or Medicaid. And he promised in a State of the Union address earlier this year that he would continue to protect the more than 130 million Americans with pre-existing conditions. But as Secretary Azar knows, this administration is now suing in the federal courts to strike down the ACA and all of its consumer protections. Overall, President Trump is proposing a 12% cut to the HHS's budget, one of the largest cuts to any federal agency. The devastating cuts don't end at Medicare, Medicaid, and the ACA. The president's proposal cuts the National Institutes of Health by $3 billion and the Centers for Disease Control and Prevention by $675 million. And keep in mind that this is the very agency that is now responding to the coronavirus. And I'm also concerned by the proposal to move tobacco regulation out of the FDA's authority altogether. Instead, the administration would create a new untested agency to oversee tobacco products while we're in the midst of a youth tobacco epidemic. After years of regulatory uncertainty, the Tobacco Control Act clearly and unambiguously ensured that FDA would regulate tobacco products for the protection of public health. But over the last decade, the agency has worked to develop the expertise, workforce, and scientific basis to effectively regulate these products. So I'm concerned that this proposal would only serve to further politicize tobacco regulation by stripping away FDA's sound scientific and evidence-based approach and replacing it at the whims of political appointees, and it's nothing more than a gift, frankly, to big tobacco companies. Now, let me just move to the second topic at hand. After we discuss the budget, we'll ask questions of the Secretary and other top public health officials on the administration's efforts to address the coronavirus outbreak. It's critical that we get an update on the scale of the outbreak, its repercussions in the U.S., and how we can work together to ensure the safety of all Americans. I think we have one of the strongest public health infrastructures in the world, and it's more than capable of coming to an effective solution. And we should be supporting that system with all available resources. So again, Madam Chair, I thank you, and I think, well, I actually have time left if anybody wants it, but everybody gets time, or does anybody want my time? I guess not. All right. Thanks a lot. I yield back.
Gentleman yields back. Pleasure to recognize the ranking member of the full committee, Mr. Walden, for his 5 minutes for his opening statement.
Thank you, Madam Chair. Good afternoon. And Mr. Secretary, thank you for being here today. It's not the first time we've seen you, although here I think this year probably, but certainly we appreciate the work you and your team have done dealing with the coronavirus. I think I've been in every one of the roundtables and hearings that you and your team have provided for this committee and other committees. Chairman Pallone and I were the co-moderators of the first one in the Visitor Center, where every member of Congress was invited. And I was at the last one, and I was at the Situation Room at the White House before the break. And this, you know, I think you all have been very forthcoming with the facts. And for whatever reason, we haven't had a hearing here, maybe wanted to wait till this one, but I think it is important that we hear from you and the team that you're leading. And I think it's important to recognize the work that Mrs. Brooks did on reauthorizing the Pandemic All-Hazard Preparedness Act in the last Congress. We had big fights about that, but thank goodness it's in place because it's designed to do exactly what we're encountering today. Have a lead person in the administration, that is you, designated by the President, and a team ready to go. And so I guess I've been to enough of those briefings that I saw members kind of yawning at some point in those quote-unquote closed-door briefings because we're hearing it for the third time. Now, we were gone a week and a lot's changed, and we know what's happening in China is probably worse than we're being told, and I think the big issues there are supply chain as well as public health. We know it is spreading around the world, and we're trying to cope, and we know, and you've warned us, and Dr. Fauci's warned us and others expect it to, you know, this could well mutate, but that doesn't mean end of world. It can well expand. We should be ready for that. But as Mr. Pallone said, we have a terrific public health system here in the United States. A lot of that is driven at the local level, and it's important that we have those communication links in place so that when we identify something, somebody coming in through an airport, the local health officials know about it at home, and we're able to deal with it. And I think it is good to get this out in the public. I would just point out that we will hear from you and the CDC, FDA, and ASPR and NIAID to give us an update on the sidecar hearing. We have had now, 80,000 confirmed cases worldwide, 2,700 deaths. The outbreak's become a significant global health concern. Yesterday, Italy announced 300 individuals have been affected by the coronavirus. 11 had died. There's still much we do not know about the outbreak. And so we'll learn more, I guess, after this budget hearing. But it is essential that we do everything we can and provide you the assistance. And I know in the meetings I've been in with everybody else on this committee that was there to attend, you've made it clear if you need more money, you'll ask us, and we've made it clear if you need more money, tell us, and we'll work with you. Now, we'll want to get the specifics, obviously, but I know you've sent up a supplemental request for, I think, a total of about a little over $2 billion, $2.5 billion. Some of that's reprogramming, some of it's additional money. No sooner had that left your office than some politicians were on the air criticizing you for not asking for enough. And so we'll be interested to get your response to that. I do think it's also essential to look at perspectives in terms of what Americans are facing today with the traditional flu, and that we've probably lost, 10,000 or more Americans have died from the annual flu. And we have vaccines for that and treatments for that. And so we have to think about that as well and practice good public health. I was in Japan with a couple other of my colleagues on the committee, and you can't go anywhere in Japan without the hand sanitizer being squirted in your hands. And it was a good lesson, I think, for all of us, but we ought to be doing a little bit more of that here, and we'd probably help with the traditional seasonal flu and spread of other diseases. And so there's a lot we can learn from you, there's a lot we can learn from your team, and we'll look forward to hearing from you directly on that, on the record here in the public. So with that, Madam Chair, I yield back.
The gentleman yields back. I now would like to introduce our witness for today's first panel. One person alone, the the nation's Secretary of Health and Human Services. Welcome to you, Secretary Azar. You certainly are familiar with the lighting system around here, so you are now recognized for 5 minutes for your statement to the committee. Thank you for being here.
Thank you very much, Chairwoman Eshoo, Chairman Pallone, Ranking Members Walden and Burgess. Thank you for inviting me to discuss the President's budget for fiscal year 2021. I'm honored to appear before the committee for budget testimony as the HHS Secretary for the second time, especially after the remarkable year of results that the HHS team has produced. With support from this committee, this past year we saw the number of drug overdose deaths decline for the first time in decades, another record year of generic drug approvals from FDA, and historic drops in Medicare Advantage, Medicare Part D, and Affordable Care Act exchange premiums. The President's budget aims to move toward a future where HHS's programs work better for the people we serve, where our human services programs put people at the center, and where America's healthcare system is affordable, personalized, puts patients in control, and treats them like a human being and not like a number. HHS has the largest discretionary budget of any non-defense department, which means that difficult decisions must be made to put discretionary spending on a sustainable path. The President's budget proposes to protect what works in our healthcare system and make it better. I'll mention 2 ways that we do that. First, facilitating patient-centered markets, and second, tackling key impactable health challenges. The budget's healthcare reforms aim to put the patient at the center. It would, for instance, eliminate cost-sharing for colonoscopies, a life-saving preventive service. We would reduce patients' costs and promote competition by paying the same for certain services regardless of setting. The budget endorses bipartisan, bicameral drug pricing legislation. And I want to thank this committee for your bipartisan work to pass legislation such as the CREATES Act to cut patient costs and save taxpayer dollars through lower drug prices. The budget's reforms will improve Medicare and extend the life of the Hospital Insurance Fund for at least 25 years. We propose investing $116 million in HHS's initiatives to reduce maternal mortality and morbidity, and we propose reforms to tackle America's rural healthcare crisis, including telehealth expansions and new flexibility for rural hospitals. The budget increases investments to combat the opioid epidemic, including SAMHSA's State Opioid Response Program. This successful grant program grew out of this committee's creation of the State Targeted Response Grants in the Cures Act, and we were pleased to work with Congress to provide flexibility on the SOR grants for states to address stimulants like methamphetamines. We request $716 million for the President's initiative to end the HIV epidemic in America by using effective evidence-based tools. Thanks to support from Congress, we've already begun implementation of the initiative. The budget reflects how seriously we take the threat of other infectious diseases, such as the novel coronavirus, by prioritizing the funding for CDC's infectious disease programs and maintaining investments in hospital preparedness. As of this morning, we still had only 14 cases of the novel coronavirus detected in the United States involving travel to or close contacts with travelers. Coming into this hearing, I was informed that we have a 15th confirmed case, the epidemiology of which we are still discerning. 3 cases also exist among Americans repatriated from Wuhan, and 42 cases exist among American passengers repatriated from the Diamond Princess cruise ship in Japan. While the immediate risk to the American public remains low, there is now community transmission in a number of countries, including outside of Asia, which is deeply concerning. We're working closely with state, local, and private sector partners to prepare for mitigating the virus's potential spread in the United States, as we expect to see more cases here. On Monday, OMB sent a request to make at least $2.5 billion in funding available for preparedness and response, including for therapeutics, vaccines, personal protective equipment, state and local public health department support, and surveillance. I look forward to working closely with Congress on that proposal. This year's budget aims to protect and enhance Americans' well-being and deliver Americans a more affordable, personalized healthcare system that works better rather than just spends more. I look forward to working with this committee to make that common sense goal a reality. Thank you very much.
Thank you, Mr. Secretary. And we'll now move to member questions, and I will recognize myself for 4 minutes, which will be the limit for questions to the Secretary. Mr. Secretary, we know that on February 24th, the acting director of OMB, what was requested, the appropriation of $1.25 billion for emergency funding for the virus. Is that what you requested of OMB?
So the actual total supplemental authorization would be $2.5 billion. We proposed
That I know,
half of that to be covered.
The new funding is 1.25.
I do want to emphasize, as I've told the appropriators, that was meant as a suggestion of a way to fund half of it, but if Congress decides there are other approaches, we're not wed to that.
What exactly does that cover? And is it anticipatory? Now, yesterday the CDC said we need to be prepared. Essentially, we need to be prepared for a much larger spread of this virus in the United States. So, is what has been requested in emergency funding to cover a broader plan, or is it on the figures that you just gave us?
So it is to cover expenses that we believe are appropriate for 2020. So this would go through the end of 2020 fiscal year, and then we would work with appropriators on any adjustments to 2021 appropriations in the weeks and months ahead as we continue to learn on a daily basis about the spread of the disease. Core investments. First, surveillance, expanding our surveillance system for novel.
I have some other questions.
Oh, sure.
So,
Okay. But I'm happy to walk you through the 5 key
and I read
areas.
the entirety of your printed statement. I want to turn to the status of drug pricing policy proposals. If you could just say yes or no, it would be great. Have you finalized a policy ending drug rebates to middlemen in Medicare?
We did not move final with that rule.
Okay. Have you finalized a policy tying drug prices to the lower costs as the reference pricing?
We had an advance notice of proposed rulemaking, so that was not an actual formal proposal yet.
Have you finalized a proposal to make drug manufacturers put list prices in television advertisements?
We did, and much to their shame, the pharma industry sued, and Congress has not passed explicit authorization for that list price requirement in the statute that I wish they would do.
Are you planning to finalize or pursue any of these policies in the near future?
We plan to finalize as soon as we can the importation program implementing Section 804 of the Food, Drug, and Cosmetic Act to allow low-cost importation from Canada.
You know that the House passed H.R. 3. You also know that the President said that we're going to negotiate so hard, something like that. We're going to negotiate like crazy. Do you support direct negotiations?
We do not support H.R. 3 because we don't believe the negotiation framework in there is either a negotiation or actually practical and implementable. And it also just has no chance of passing in the Senate. The bipartisan package of Grassley-Wyden is struggling even to get to the floor there.
Well, H.R. 3 caps out of pocket, as you know, prescription costs for seniors. Do you support the capping of out-of-pocket costs for them?
We have an important opportunity here,
Yes or no?
bipartisan,
Yes
to
or
cap
no?
out-of-pocket spending and reduce what seniors
Yes or
will pay
no?
in Part D. So, yes, we do.
Okay, good. Well, I think that I've asked all, let me just, well, H.R. 3 also limits drug price hikes to inflation. Do you support the inflation caps?
So that is part of the Grassley-Wyden package also in the Senate. And
You support it?
we've made clear that that's a package we can support. It's not the only bipartisan package, but the price inflation penalties in Part D and B are acceptable to us as a means of getting list prices under control.
Thank you. My time has expired. I now would like to recognize the ranking member of the subcommittee for his 4 minutes of questions.
Thank you. Mr. Secretary, in December of 2018, the President signed 2 important bills into law that addressed maternal health and maternal mortality. The first bill, Representative Jamie Herrera Butler's Preventing Maternal Deaths Act, established a grant program for states to establish or expand maternal mortality review committees. The other bill, Improving Access to Maternity Care Act, required health resources, HRSA, to identify maternity care health professional target areas. So how have you used these bills? How is your agency building on the success of those two laws to ensure access to quality maternity care and prevent maternal mortality?
First, could I thank you for your leadership on immunosuppressive drugs? I hope you saw that we put in the budget what you've long advocated for in terms of that coverage.
Yes, you may say thank you. You're welcome.
And on maternal mortality, also, the work of Congress really focusing on this critical issue. Too many women are dying either in childbirth, preterm, at childbirth, or postpartum. And so we have made this a serious part of the president's agenda with $116 million initiative, $116 million initiative with a $74 million increase that focused on improving prevention, quality improvement, postpartum health, and improving the data collection on that. So a four-part strategy that we look forward to working with Congress on coming out of the budget.
Well, thank you for that. Republicans in this subcommittee in 2017 sent your predecessor, Secretary Price, a letter asking for HHS to update and release the pandemic flu influenza plan, and previously had not been updated since 2005. Can you describe how you are using the pandemic influenza plan as a guide in preparing for your response to this current outbreak of coronavirus?
So as you know, I was one of the architects of the original pandemic plans back in the Bush administration. That work is foundational. That's what has set up our entire state, local, and federal preparedness program for any type of viral outbreak like this. And so it's really it is the blueprint for how we are operating today, including my role leading through the Emergency Support Function 8 under the National Response Plan, which is the doctrine that we've had in place now for 15 years.
Let me just say, this committee did do work on H.R. 3 last October. There was concern from many of us that the negative effects on innovation and development would really be profound. And now we find ourselves confronted with this coronavirus outbreak where we know we need new antivirals. We know we need new vaccines. We know we need new monoclonal antibodies to help people who become ill. Can you just speak to the fact of, is innovation still important? Because we heard several times in this subcommittee and in the full committee that maybe innovation wasn't so important as getting cheaper drugs into people's hands.
Innovation is vitally important, and that's why two of the key legs of the supplemental request are to develop vaccines and therapeutics for this novel virus. One of the challenges with H.R. 3 is the sheer amount of money it would pull out of the system. And I'm not a believer that if you pull any money out of the drug industry, it's catastrophic or impossible. But the sheer amount would materially impact the bringing forward of drug therapies for Alzheimer's, for arthritis. Just go through the list of therapies that you need to incent or you won't get them.
Yeah, and interestingly enough, the Alzheimer's drug that was withdrawn a year ago, I'm reading, is now getting a new look at different dosing schedules. And again, work like that's not going to happen if we don't value innovation. But Secretary, I thank you for being here, and certainly look forward to the second part of this hearing. I yield back.
BARDA biodefense budget has also been cut. Now, glad to recognize the chairman of the full committee for his 4 minutes of questions.
Thank you, Chairwoman Eshoo. Mrs. Secretary, I thank you for appearing before our subcommittee today, but I continue to be upset by the Trump administration's decision to ask the court to strike down the ACA in the Republican lawsuit that is seeking to declare the entire law invalid. If the district court ruling is upheld, then the Trump administration will be responsible for the largest coverage loss in U.S. history. Over 20 million Americans would lose their coverage, raising consumer costs and making life-saving health care unaffordable for American families, and it would eliminate protection for pre-existing conditions, adversely impact the Medicare program, and end Medicaid expansion. So I've sent you 3 letters now, including one in April of last year, requesting any analysis, study, assessment, or reports regarding the potential impact if the entire ACA is found to be unconstitutional. And for almost 2 years now, I've repeatedly asked for any documents relating to any contingency plans in place in the event the ACA is found unconstitutional. Only last week, I received a 1 and 1.5 page response that answers none of my questions, frankly. and the documents produced so far to the committee answer none of these questions. So I'd like to submit to Madam Chair my letters and the department's response in the record. I'd ask unanimous consent.
So ordered.
So really, I've got 2.5 minutes here, Mr. Secretary. I think the American people have the right to know what the administration's contingency plans are, given the president asking that this entire law be declared invalid. Maybe you just have to answer yes or no. We'll see. I only got 2 minutes. Secretary, has the department conducted an analysis to evaluate the impact on individuals with pre-existing conditions and their access to affordable health insurance if the ACA is found unconstitutional? Yes or no?
Of course, it's not going to be left just like that. We would replace with something that would actually deal with pre-existing conditions. And
but have you done any kind of contingency plans at what would happen if the court struck down the ACA?
We're always considering different options, but it will depend on the nature of any ultimate court decision, if it even agrees with striking down all or part of the ACA.
Well, it doesn't sound like there is such a thing. Has the department conducted an analysis to evaluate the impact on premiums and access to coverage in the individual market, particularly for individuals with pre-existing conditions, if the ACA is found unconstitutional? Yes or no?
Well, it depends on what would be struck down, whether all of it's struck down, part of it, or none of it. Okay. We are years possibly away from a final court decision.
All right, well, let me issue this. Are there any contingency plans to ensure that the 20 million people who are covered under the ACA do not lose coverage? Anything at all?
Well,
Any
first,
contingency
we have been emphatic that we are changing nothing about how we administer this program during the pendency of the litigation. And at the time that if there is a final court decision striking down all or part of it, it will depend on the context of that decision and the politics, frankly, of who's in Congress and what we can work with to ensure the protection of existing conditions.
It sounds like the answer is no. You don't have anything yet. I would just like a commitment from you, basically, to respond to my request, to provide any documents to the committee that relate to contingency plans in the event that the ACA is struck down. Can you give me that commitment?
I'm sure you'll understand that deliberative process regarding potential legislative proposals are some of the core of the internal executive department's functions.
So it sounds like the answer is no. Well, I just think that it's unfortunate because, our oversight responsibility is to make sure that in the event we have this terrible situation, that there is some kind of contingency plan, and I don't think you have it. So I don't believe the administration has any kind of comprehensive plan to address the fallout that will occur if this Republican suit is successful in court. Thank you, Madam Chair.
The gentleman yields back. The chair recognizes the ranking member of the full committee, Mr. Walden, for his 4 minutes.
Thank you, Madam Chair. Mr. Secretary, again, thanks for being here. I want to make a couple of points. One is on the opening day of this Congress, I led the effort on the House floor, now in the minority, trying to move an effort to protect people with pre-existing conditions pending this lawsuit's decision. Congress could act. This House could move legislation to put into law certainty to protect people with pre-existing conditions, in addition to the laws that are already on the books dealing with pre-existing conditions. But my colleagues have chosen not to do that. So they could, and we would probably find common ground here on a pre-existing severability language. There's a lot that could be done here. Second, it was the Congressional Budget Office, independent, nonpartisan, that said, I believe 8 to 15 new medicines would never be invented because of H.R. 3, Speaker Pelosi's partisan drug pricing bill. As you said, that could be a cure for Alzheimer's. It could be a cure for the coronavirus. We don't know. And that's just in the first 10 years. The further out you look, the more future innovation would be lost. California Life Sciences said upwards of 85% of what they invest in would go away. 80,000 U.S. jobs, 80,000 is what California Life Sciences said. We'd lose the R&D, we'd lose the innovation. Now, no president, I've been around, Republican or Democrats, ever leaned in harder on these issues of cost of care than President Trump. And I was with you and him when he announced the effort to get transparency in the hospital system. And before we got from the news conference to the Oval Office, I believe the hospitals had sued you. Is that correct?
I believe it is, yes.
Yeah. And And you talked about the drug disclosure and advertising, and what happened there?
Rather disgustingly, the pharmaceutical industry sued us to conceal their list prices from their consumers.
And so then I want to talk about Medicare Part D. We were all working together on this committee, which we have a great reputation of doing. Occasionally we fight, and that's all right, we know it. But we were working together to cap the out-of-pocket cost for seniors under Medicare Part D and modernize Medicare Part D. When all that, unfortunately, came to an abrupt halt, driven, I'm going to say, from the Speaker's office, those discussions ceased. But we agreed that we needed to cap out-of-pocket costs. We put that in our bill, H.R. 19. They put that in their partisan H.R. 3. But we all agree that it's time to cap the out-of-pocket costs for seniors in Medicare. Does the administration support capping the out-of-pocket costs for seniors in Medicare?
Absolutely.
Did the administration oppose H.R. 3?
We do oppose H.R. 3.
Did the administration support the concepts of H.R. 19, our alternative?
We support the elements of it, absolutely, including the notion of capping out-of-pockets and saving seniors money.
One of the big issues we've dealt with here, or tried to, is the high cost of insulin. Not just for seniors, but for others. But in our alternative, H.R. 19, that was all bipartisan legislation, we capped cost of insulin, I believe, at $50 a month was the maximum. Does the administration support that concept?
I believe so, yes.
So going forward, are you hopeful that the Congress and the administration can get together on a plan the president can sign that can become law that would actually reduce the costs of pharmaceutical drugs in America without driving innovation away?
Yes, I have said the administration is the most flexible party here. Republicans, Democrats, Senate, House, get list prices under control, lower out-of-pockets, and give the drug plans the real incentive to get drug prices down.
H.R. 19 contains about 80 or 90% of the Wyden-Grassley bill. We think we're with you. We think we can get there if we can just put the partisan weapons away. Thank you, Mr. Secretary, and I yield back.
Gentleman yields back. Pleasure to recognize the gentleman from New York, Mr. Engel, for his, is it 4 minutes? 4 minutes of questions.
Thank you, Madam Chair. Secretary Azar, the state of New York was extremely disappointed to hear that CMS has denied the state's request for a renewal of its delivery system reform incentive payment program known as DSRIP. When the program was first approved, CMS and HHS insisted that New York include targets for the state's Medicaid program that would incentivize providers to move away from fee-for-service toward value-based payments. New York's health care community has made progress in doing just that, receiving double-digit reductions in preventable hospital readmissions while saving the federal government billions of dollars. The request for additional time and continued investment of those savings in DSRIP was to move closer to exactly what CMS and HHS have been saying the federal government wants everyone to be doing. So in light of that, why would CMS and HHS want to stop supporting these successful efforts to achieve the very goals that the Trump administration has been saying that it has for health care? So will your department commit to meeting with the state of New York to discuss how these reforms are sustained into the future? I'd like a yes or no answer if I could get it.
Yes, I'm not familiar with that particular program, but you're right, we do support value-based transformation in our programs. I don't know the particulars of why CMS has had difficulty with New York, but yes, we'll be happy to sit with New York.
Okay, and I'd be happy to sit with you as well.
Thank you.
Discuss it. Mr. Secretary, we've mentioned it here, other members have mentioned it here. You know it far too well, that Americans are suffering from the current epidemic of skyrocketing prescription drug prices. My constituents always tell me they're having to make unconscionable choices between paying for food or filling a life-saving prescription such as insulin. The House has taken bold, decisive action to lower drug prices through H.R. 3, which provides a common-sense solution to this crisis by allowing the government to negotiate drug prices. That's a policy that the President supported as a candidate in 2016, saying, and I quote, "When it comes to negotiate the costs of drugs, we are going to negotiate like crazy," unquote. That's from the President. The administration has yet to deliver any meaningful solutions for the health crisis. In May 2018, your department released a blueprint to lower drug prices, but many of those policies fail to materialize or provide minimal relief to patients. Other ideas, such as the International Pricing Index, has been shelved. Despite these failures, President Trump claims to have reduced drug prices, when in fact a recent report showed that on average, drug prices increased by over 5% at the start of this year. Mr. Secretary, can you commit to me today that you will deliver on the President's promise to negotiate drug prices? I'd like a yes or no also.
So we support bicameral, bipartisan legislation that would get through, and there are many principles in H.R. 3 the President is supportive of, but it has to pass both houses of Congress. And at the moment, H.R. 3 doesn't have a chance of seeing the light of day in the Senate, and so we need to work together to see if something can get through both chambers.
Well, I'm sure if the President asked Mitch McConnell to put it on the agenda, he would.
I don't think so.
There are plenty of things that we've passed in this House that unfortunately the other body hasn't done, and the President seems to be right along with it. So I just think it's another example of the administration's broken health care promises to the American people. I just think that we need to get those prices of drugs down, and we need to have not empty rhetoric, but true facts. And I yield back the balance of my time.
The gentleman yields back. Pleased to recognize the gentleman who was the former chairman of the full committee, Mr. Upton of Michigan, for his 4 minutes.
Thank you, Madam Chair. Mr. Secretary, welcome. Big time. So as you know, this committee on a unanimous vote passed 21st Century Cures as we call it. When I was chair, we expedited the approval of drugs and devices, and I would suspect strongly that your testimony that we had a record number of generic approvals is a direct result because of what this committee did. We also added some $45 billion in health research over a 10-year span. And frankly, we asked the question of the agencies as we worked on this legislation, what is it that we could do to help you make sure that we hit these targets of faster approvals of drugs and devices? And so whether it was the FDA, the CDC, and others, the NIH, obviously, they gave us an answer, and we delivered. And at the end of the day, for this crisis, we are going to find a vaccine to solve coronavirus. I know that we are, and I'd like to think that what we did in this committee and then passed on the House floor will be a direct result of that. And frankly, it prompts all of us, I think, to ask the questions of what more can we do to get on a faster pace to find that vaccine and that cure. And in fact, as you may know, Diana DeGette and I are, again, working on a 2.0 cures bill where we can take these 3 years since President Obama signed the bill into law and ask those questions to see what constructively we can do so that all hands are on deck. And I know, don't have to ask you, I know that you will help us with ideas to do that. Question that I have is a containment in the very first step in responding to any outbreak of coronavirus. We've seen that around the world now. And statements from yesterday indicate that the CDC said it really isn't if, but when it gets to a larger numbers here in the United States. I've always believed in the adage that if you're going to do something, better do it right the first time because you're not going to find a second. And and you want to make sure that pay me now or pay me later. So we need to have the right numbers as it relates to fighting this terrible disease. Is the $2.5 billion, is that a floor? Is that a suggestion, the $2.5 billion that you requested?
We have described the request as at least $2.5 billion for 2020 money, and then work on 2021 money as we see the situation develop over the weeks and months ahead.
So I know that we're waiting to see the precise details of where it's going. Are any of those dollars envisioned to include the contingency of what China has done as it relates to regional quarantines?
No, we don't envision that as a kind of practical step here in the United States. That we would, as Dr. Messonnier spoke about yesterday, in the event that we had community-level outbreaks, which might be small, just a town, a city, if we had that, we would take the pandemic playbook, which is community-based mitigation steps, social distancing. It is very rare that those types of cordon sanitaire efforts around cities they are effective. They usually provoke more panic and cause people to actually leave and spread. Now, China's a different government and culture than we have here.
Of the 14,000 Americans that have died this flu season, do you know what percentage of those were not vaccinated?
I do not have the numbers. Historically, our youth who die tend to not to have been vaccinated, which is a real tragedy.
And the last question, has there been any query of those 55 Americans who currently have been diagnosed with the coronavirus? Did any of them have the flu vaccine? You know, was that question asked of any of the 55?
I don't know that that would have been asked. We don't, of course, have any evidence that the flu vaccine would have any properties related to the novel coronavirus, but I don't know if that was asked as part of intake for the patients.
Okay. I yield back.
Gentleman yields back. It's a pleasure to recognize the gentlewoman from California, Ms. Matsui, for her 4 minutes of questions.
Thank you, Madam Chair, and for holding this important hearing, and welcome, Mr. Secretary. Before getting to my line of questioning, I do want to express my deepest concerns about the Medicare, Medicaid, and other cuts included in the budget. At a time when we're dealing with the coronavirus outbreak, an addiction crisis, and a lawsuit that threatens ACA protections for pre-existing conditions, the administration's cuts to critical safety net programs target the most vulnerable in our communities and aim to further erode access to vital health care services. We should be prioritizing primary comprehensive care, particularly in the mentally ill and people with addiction. I believe mental health is an area where we have an opportunity to work together and make progress. Mr. Secretary, I appreciate the Department's strong support of the Certified Community Behavioral Health Clinic Medicaid demonstration. As you know, Representative Mark McWay-Mullen and I are working to further scale the program with our bipartisan legislation, the Excellence in Mental Health and Addiction Treatment Expansion Act. For the 8 states currently participating in the Excellence Demonstration, we have studies showing that quality mental health services, outpatient care, and addiction treatment provided at these facilities are saving lives and money. People are avoiding jails and emergency rooms, instead getting the comprehensive care they need in their communities. We have 11 additional states that are ready to participate in an expanded excellence program. Our bill has a bipartisan group of 88 co-sponsors who support this full expansion, and the House has already voted to extend the program longer term. I was very pleased to see that the budget this year explicitly endorses extending the excellence demonstration, and I believe we do all agree, Mr. Secretary, that adequate Medicaid resources around substance abuse treatment are essential to fighting the opioid and addiction epidemic. Mr. Secretary, I have a question. Under the leadership of Chair DeLauro's $200 million was made available to HHS in FY20 to help states prepare for eventual participation in the excellence demonstration. How does HHS plan to obligate these resources?
First, thank you for your personal leadership on the Certified Community Behavioral Health Center issue. That is, you're right, the data is showing really positive results to date, so thank you for that. In terms of your work with Chairwoman DeLauro, SAMHSA is now accepting applications from states for these grants to increase access to and improve the quality of community mental and substance use disorder treatment services through the expansion of CCBHCs, and the deadline for states to apply is March 10th.
Okay, thank you. The positive impacts of the demonstration make it clear that there's room to improve mental health and addiction care in this country by scaling this program. In California, our county hospitals, public academic medical centers, and public children's hospitals rely upon financial arrangements that leverage public funds and partnerships as essential means of providing health care to the most underserved communities and patient populations in the state. I have concerns about the administration's recent proposal to eliminate these sources of funding, particularly supplement payments. I worry that if finalized, the Medicaid accountability rule will destabilize the whole system of care provided under Medi-Cal. Medicaid supplemental payments are an integral component of total Medicaid reimbursement that providers rely on for adequate reimbursement and financial stability. Mr. Secretary, have you weighed the restrictions on supplemental payments against the adequacy of these base payments, are there plans to make any corresponding adjustments to base payments for these providers?
So we're hearing the very important feedback from you and others about that regulation, and we want to take that in as we look at how and whether to finalize at CMS on the relationship of these intergovernmental transfers to supplemental payments, and also if there are ways we can work with states to restructure payments in a way that would be consistent with the law. So we want to work with the states, not be adversarial to them on this.
Okay, but thank you, Mr. Secretary, and I yield back.
Gentlewoman yields back. Pleasure to recognize Mr. Shimkus of Illinois for his 4 minutes of questions.
Thank you, Madam Chairman. Thank you, Mr. Secretary, for being here. Coronavirus is a novel pathogen, as a lot of us know. But in your testimony, you also mentioned emerging microbial threats. And Madam Chairman, I'd like to ask to submit in the record this news release from the World Health Organization on the 17th of January, 2020.
So ordered.
And in the 114th Congress, I joined with Gene Green on what we call the ADAPT Act. Last Congress, it was Tony Cardenas and I, with the help of the now chairman of the subcommittee, Anna Eshoo, who joined, and technical assistance by HHS on what we call the Revamp Act. And it's an attempt to address how, if you have these antimicrobial resistance, how public funding may not be the only way you can address this. Can you talk about that challenge?
Yeah, I'm very concerned about the drug development around antimicrobial resistance in terms of creating a sustainable market. You know, we've had actually tremendous success from the efforts you've led and the Congress has led and BARDA at my agency have supported. We've supported development of 16 novel antibacterial projects. I believe 3 have actually come to market. What we're finding, though, is there's a market failure question here where you're basically asking a company to develop a drug, but then not to have it used much. And that's not a usually sustainable business model. So I've actually commissioned my team to work on how can we possibly solve that? Is that more like a bioterrorism chemical countermeasure and the approaches that we need there? Quite concerned about this situation.
And that's what we've tried to do legislatively, and at some time one was the tradable vouchers debate, which I think still should have legs, especially in this concern of, as you put it, trying to have something on the shelf that you don't want to use. That's the key. Scott Peters and I are also working on legislation that we call Ending the Diagnostic Odyssey. And it is an attempt to help DNA sequencing so that when there's a disease or some event, you don't have to test. You can go just through the sequencing aspect of that. Any thoughts on or comments of what you all may be doing that we don't know about in trying to push more DNA identification?
So I've not studied that particular issue. We're happy to get back to you on that. It certainly is at the fore right now as we deal with novel coronavirus and have the CDC diagnostic, but also hope that commercial innovators will develop physician bedside diagnostics for rapid in-site testing.
Yeah, and this is timely. Well, obviously it's timely because of the threat that we're all concerned about now, but it's also Rare Disease Week, and a lot of that community is looking for this as a novel way, especially on that, what we call that diagnostic odyssey, where they just, and we see that with people who are struggling with just types of cancer and trying to identify the right treatment early versus what I would say sometimes is a trial and error method that is very damaging to the health of the patient. And with 30 seconds left, I wanted to just briefly, and it's been asked a little bit before, you all do support Medicare D reform, is that correct?
Oh, absolutely. It's a real opportunity for seniors.
And how would reform lower patient out-of-pocket costs?
Well, you would cap catastrophic payment at the limit at $3,100, so a patient would never pay more than $3,100. And then at least the Grassley-Wyden plan, the senior could actually opt into a program where they would pay no more than $258 a month for their drugs, no matter what their expenses are.
Amen.
Gentleman yields back. The gentleman from Maryland, Mr. Sarbanes, is recognized for his 4 minutes of questions.
Thank you, Madam Chair. Secretary Azar, you certainly know that the popularity of e-cigarettes has recently led to an unprecedented surge in youth tobacco use, and it's bringing back with a vengeance the tobacco epidemic in this country we've worked so hard to curb. It shows why we have to improve the law, and something that this committee has been working on. Unfortunately, the Trump administration is now proposing, as I understand it from the budget, removing FDA's oversight of tobacco products in favor of an untested agency that will take years to get off the ground, which threatens to set us back even further. I'm perplexed that the administration would decide to do this, remove FDA's authority, alter the agency's public health mission, which includes making, quote, tobacco-related death and disease part of America's past, not America's future, and by doing so, ensuring a healthier life for every family. This latest move is kind of breathtaking. It makes no sense. It's a crazy thing to do by the administration, which unfortunately hasn't taken significant action against big tobacco as more of our nation's youth are becoming addicted. In January, after heavy lobbying from big tobacco, as we understand it, and the vaping industry, and listening to partisan political consultants like Trump campaign manager Brad Parscale, the administration reversed course, and we were on a trajectory where we thought everybody was on the same page. The administration reversed course, announced a policy which failed to ban all flavored e-cigarettes, allowing popular menthol cartridges to stay on the market, and allowing all flavored disposable e-cigarettes and open-tank e-cigarettes to proliferate through our nation's schoolyards, which is exactly what they're doing. And I'm concerned that removing this authority from the FDA, which is part of the proposal, could lead to even more loopholes and more industry influence. My question is this: when formulating the budget proposal to remove the FDA's tobacco oversight authority, did you, your agency's staff, White House staff, or staff of the Office of Management and Budget speak or meet with any lobbyists or other representatives of the tobacco industry, or for that matter, political operatives who work for or are contracted by the president's reelection campaign?
Well, I can't speak for others. I'm not aware of any such deliberations. The idea was that if we move the Tobacco Center out from under FDA, first, if it were a presidential appointed Senate confirmed leader, they'd be more accountable to Congress. Second, as a direct report to me or whoever is secretary, elevating the role of tobacco control there. It has always been a little bit of an odd connection. FDA is about safe and effective, whereas the Tobacco Center is about regulating a product that is undeniably bad. And so there's a...
It doesn't make any sense, does it?
Well, it would, of course, be subject to Congress if it was something...
I mean, we're at the height of we're at this tipping point on this epidemic when it comes to vaping. I mean, there does reside, however you want to carve up what you consider the appropriate mission of the FDA to be. There certainly resides within FDA now significant expertise and experience in terms of dealing with this issue. Why you would propose at this moment in time, when this epidemic risks, in a sense, overtaking the dimensions of the previous tobacco epidemic that we saw in this country, by zeroing out that authority and moving it to an untested new agency, which, by the way, I think would be more susceptible to political influence of the kind I was just recounting than it is now. It doesn't make any sense to me. I urge you to reconsider that. We are in the midst of this crisis, and we have to use every tool available to us here in the government to respond to it. With that, I yield back.
The gentleman yields back. There is 5 minutes and 22 seconds left on the clock. Any member that would like to leave to vote, when we get to, you can leave now. When the clock goes to 0, they will hold the vote open for those that have not arrived from our subcommittee, and at that point we'll take a 20-minute break. But now I'd like to recognize the gentleman from Kentucky, Mr. Guthrie, for his 4 minutes of questions.
Thank you, Mr. Secretary. I look forward to getting into the coronavirus. I'm doing that my second round of questions. So the Support Act we passed last year included my bill, the Comprehensive Opioid Recoveries Act, to establish treatment centers that offer FDA-approved medication-assisted treatments, all of them comprehensively. Currently, SAMHSA has the grant application open for entities to apply, and I'm glad HHS is moving fast on implementing the program. But my question is, how is HHS implementing other parts of the Support Act, and does HHS conduct any oversight on how the funds are actually being used?
So first, thank you for the Support Act, and it is so comprehensive, we actually established a Support Act Implementation Leadership Committee to track all of the different work streams needed under the Support Act. It's really enhancing our work across all 5 elements of our strategy on opioids, and so we're driving forward, making progress on the opioid epidemic. We got the overdose deaths are down for the first time in decades as a result of our collaborative bipartisan efforts here. And we're implementing and using the Support Act authorities, so thank you for those.
Okay, thank you. And also in 2018, Congress passed my bill, the Bipartisan Bold Infrastructure for Alzheimer's Act. Can you please provide an update on how this law is being implemented across the country?
So with that act, I'd want to, if I could get back to you in writing on that. I don't have all the details on that particular program. I apologize, but if I could get back to you.
Okay, thank you. And then this is kind of technical for my role as ranking Republican on the O&I subcommittee for this committee, and this committee and O&I conducted extensive oversight, cybersecurity at HHS, including through technical audits conducted by GAO of cybersecurity controls at HHS operational divisions. So I said it's very technical. Last Congress, the subcommittee on oversight and investigations held a closed hearing in part because HHS failed to properly identify and address certain vulnerabilities. We recently received preliminary results from the most recent audit of another HHS agency, though I can't go into details in this setting. So my question is, does HHS have a point person who coordinates corrective actions on cybersecurity among all HHS agencies? And if so, we direct that person to continue to work with the committee on improving enterprise cybersecurity at HHS and ensuring that mitigations applied in one setting are consequently applied through all of HHS.
Yes, we do. Our Chief Information Officer, Jose Arrieta, who works directly with me, absolutely is in charge of those issues. If I could go back to your previous question, I'd misheard on the BOLD Act.
On BOLD Act, yes.
So I apologize on that. For fiscal year 2020, CDC will have 2 funding opportunities to carry out actions under the BOLD Act. So first, there'll be the public health programs to address Alzheimer's disease and related dementias. And second, there will be the health centers of excellence to address Alzheimer's disease and related dementias. We expect both of those funding opportunities to be out in the coming month. And for FY 2021, the President's budget for CDC includes $3.493 million to continue to support these Alzheimer's activities.
Because by 2050, that's when I'll be 86, I believe, they believe it's going to be estimate CBO, $1 trillion spent on Alzheimer's disease. Not only is it devastating to the individual who has it, the family that cares for that person, but also it'd be devastating to the deficit in the budget of our country. So this is something very important. Thanks for your leadership and effort, and I appreciate working with my colleagues here to move the BOLD Act forward and address it. And I yield back.
Gentleman yields back. Pleasure to recognize the gentleman from New Mexico, Mr. Lujan, for his 4 minutes. And I'll wait right here with you, and then we'll run over.
Thank you, Madam Chair. Secretary Azar, when Donald Trump was running for office 4 years ago, he famously said that he wouldn't cut Medicaid. He didn't say it once or twice, but claimed it at least 5 separate occasions that he would not cut Medicaid. But in reality, no president and no administration in the last 50 years has done more to undermine Medicaid than Donald Trump. In fact, his first major legislative effort to repeal the Affordable Care Act would have ended Medicaid as we know it and put the health care of 70 million Americans at risk. And if my colleagues from the other side of the aisle want to protect people with pre-existing conditions, they should drop the lawsuit. That could happen tomorrow. After President Trump failed to cut Medicaid legislatively, he decided to try the same thing administratively, even though the law clearly does not allow it. Secretary Azar, there's been some misreporting that the block grant guidance is limited to adults in the expansion population. But under the administration's guidance, states could block grant Medicaid for more than just expansion adults. Isn't that true?
Congressman, I don't believe that's the case. I'll ask the CMS administrator to get back to you on that, but My understanding was that it would be an optional demonstration for adults only, and that it would actually not affect coverage for our most vulnerable, our pregnant women, children, elderly adults, people on the eligible on the basis of disability.
So
but I'll ask Administrator Verma to get back to you on that, because that is not my understanding.
Let me jump into this. I'm glad that you pointed that out, because I believe that there is a concern here, and I hope that you would agree with me if that's your understanding, that you do something about it, Mr. Secretary, because the Center on Budget points out that people that are low-income parents, women who are pregnant, and people with disabilities who are covered through Medicaid expansion could be included in what I will describe as the President's illegal block grant guidance. Is that something that you would agree with? If that's the case, would you stop it if, in fact, the guidance does allow for those vulnerable populations to be discriminated against?
So I have been under the view that it does not affect coverage for our most vulnerable populations. It doesn't allow them to strip benefits, strip eligibility. Essential health benefits have to be covered. You can't change eligibility. You can't cap or limit.
So, Mr. Secretary, if I may, just for clarification, because it sounds like we're on the same page.
What you're saying, I'm not, the concerns you're expressing, I don't believe
Mr.
are in the
Secretary,
HOA, but we'll get back to you on that.
Let me ask you this pointed question.
Yep.
If, in fact, the President's Medicaid block grant program does allow for those folks to be thrown off and get caught up in this, will you stop it?
Well, we're not going to approve plans that allow people to be thrown off because it can't change eligibility.
Let me ask the question one more
It's not
time, because
part
it
of the
sounds like you're
program.
getting there. Mr. Secretary, if in fact vulnerable populations like pregnant women, families, those that are disabled, are subject to this rule where they could be block granted, will you stop it?
I don't believe we would. I will not approve a plan that removes coverage for our most vulnerable citizens.
So that's enough for me. You said you will not
I will
approve a plan.
with very low-income parents, children, pregnant women, elderly adults, or people eligible on the basis of disability should not be removed, should not be affected in terms of their Medicaid coverage, is what I'm informed. I'll get back to you from Administrator Verma to confirm all of those details. I want to make sure that I'm right on that, but that's been my understanding of the HOA program.
What I'm looking for is assurance that if what my comments are associating with being consistent with the Center on Budget points out, you in fact will not approve that plan, and you will not allow for Medicaid block grant cuts, devastating cuts, go into place that will be subjected to pregnant women, families, and those with disabilities.
The categories that I mentioned before are ones that I do not believe are subject to it, and plans should not be approved if they would harm eligibility for those individuals.
So if the Center on Budget's assessment is correct, you will not allow that to go in effect?
I do not believe their assessment or description of the program is correct, and I've said I don't expect that I would approve any plan that would harm our vulnerable populations. It is a healthy adult opportunities under Medicaid expansion, but we'll get you any clarification on that afterwards.
Well, thank you, Madam
Appreciate you
Chair.
raising that to me.
There's a reason that most of us in this Congress have opposed Medicaid block grants. These are devastating programs. It's another effort to undermine Medicaid and to continue to cut the program, which President Trump promised he would not. This is another example of where he is. And with that, I yield back.
The committee will now recess for approximately 20 minutes. So hold on to your seats while you stand up and stretch, and we race over and come back. Sounded like the secretary said yes, Ben Ray.